Oh, it's tolerable.
Okay.
Yeah. Relative. So probably for about a decade, it's like my ribs almost like don't know where to sit.
Okay.
And the back pain, so like burning, stuff like that. I now know like this movement is reflecting. Right. Yeah. Same like T7, T8 connection. And then the ribs started moving more here. Okay. So about October of last year, some on the left side, no, on the right side, sublux, whatever you want to call it. I know there's different terms for that. It was not in the place that it should be, and was pinching a nerve, went to a chiropractor, couldn't like really move a lot, and that was about a month recovery, and then it happened on the left.
Just local pain, or was it radiating? Was it just back pain, or was there stuff, were you feeling kind of shoot around, or you
It was radiating, but at that point it was like sitting right on the nerve or something.
Okay.
And then the left side is actually more of a problem, and that's like the original thing, but I was, compensation, using the right, and so that was actually the first two. I was just like reaching for something, and not that the reaching for something was like the end all be all, but yeah.
Have you had any injuries or falls or anything, traumas to that area?
No,
before?
I have racked my brain for how this could have like progressed, but I think for me it's almost like a slow progression of things adding up. So now knowing, about curve, and it's not like I had terrible posture, but I think just like small things over time. Yeah. And then I danced like all until about 24.
Tell me about, is this just achy? How would you feel? How would you describe the pain on that? This is called the costal cartilage right here. I'm just curious.
So I'm always like massaging in between.
Feel sore?
It's super tender, really sore, and it kind of like, so I can't lay on my side or my stomach. It just kind of aggravates it. And the right started moving, I think it's about rib 9.
Okay.
Started moving probably earlier this year. And at that point I was like, okay, now like both sides are, so I started to like feel a little bit of the movement. So I can show you. It also is like a bit thicker right here, and I don't know.
So they did x-rays of your chest. Did they see any scoliosis? Did they take x-rays of your chest?
Yes, there's like a little bit of a curve, like extra curve here, extra curve.
The little lateral curve on the thoracic?
Just a little bit. They were saying it was just like a functional in avoidance of like it curves this way a little bit and then curves that way a little bit. Well, I guess my main thing like for you is either affirmation or whatever that what I work on with my back, is that going to impact enough of like rib stability, I guess.
When you said stretching, can you describe more specifically what do you mean by that?
So I have a can I show you?
Sure, please. Yeah, you're the trainer.
Yeah,
the trainer.
Yeah. And then I didn't break my neck general because I was like, yes, I'm here. Okay. I've been off and on trying the trainer or whatever you call it.
How upsetting is that in there? Is it pretty sore?
Incredibly, and it's actually been a few months of me like trying it on and off, and that's why, and he actually has the one that's like more specific, and I try it every once in a while, but.
So a lot of the soft tissue work is, I call it prep work. We got to clean that tissue. The soreness that you're feeling is, adjustments can do it in themselves. It takes a little longer. I can speed up or expedite this process by gua shawing and elbowing. We can make it, say that all that inflammation or lactic acid you'll see as the gua sha mark, that's all going to create a lot of local, you don't want to confront it. This is why people round forward. And then we compress and, inflame the ribs on the front because we're in avoidance of an injury on our back, or even just years of being a student and sitting, and many times this becomes all glued together. This expands open, and it's a slow postural, degradation.
It's like, I think it's at the end of like rib 8 or something like that. It's like the actual, it's like thicker.
This protrudes more than on this side. Yeah. There's probably a little bit of rotation. Maybe it could be, like I said, they were saying functional. Again, if it's functional, it'll go away more easily than a structural scoliosis. So there's two different types of scoliosis. If it's just because you're in pain, your body's trying to shift away, or like me, it's a structural. This sticks out more because of that laterality
Yeah.
You know, like definitely your left shoulder's high. You know,
which used to be significantly higher.
Right.
Yeah.
This to me would be more exactly, there's an injury on the right side of your neck, and that makes your head tilt left, and then because your head's tilted left, you drop your shoulder to make your eyes level, but it's really an injury on the right side of your neck that's causing a head tilt. Again, these can create functional scoliosis because of you're in pain, your body's shifting things around. Go ahead, stay right there and we'll get you.
I guess my question is, well then how did that start, you know?
It starts because we don't have any proper care in our world for prevention on spinal problems. We're not taught to brush our teeth in the sense of our spine. We're left to wait till symptoms happen before there's care. You don't have Dr. Bo as your father.
Yeah.
You didn't have. You know, I got injured as a kid. I got adjusted right away. You got injured and it was like walk it off, kid.
Change the trajectory. Yeah.
Right. You healed however you were going to heal, compensating, and then you actually healed in a chair. You know, you go to school and you sit for 8-10 hours or longer, and then we heal cocooned and rounded forward. Most vehicle seats are all rounded forward for crash safety ratings, and so if we drive a lot or work now after school sitting, that propagates the problem. The ribs, all of this in here is secondary to the much larger problem of your lower back. So what happens is if this goes unaddressed, most people do just pop some pills and ignore this, and it will lock down, and you'll forget about it because it'll become so frozen. Even this, do you understand?
Yeah.
And it's like it's gone, and then by 37, you'll have sciatica because this being tight for
overworking
10 years overworks your lower back, and that's more 10 times more impactful for your long-term health.
Yeah.
Is about learning how to keep your chest mobile. What you're seeing is your body shifting things around because it's trying to lock down. That's actually your primary engine in there, and it's actually moving. It's been injured. It's trying to stiffen down, and we're going to keep it moving. That's part of what you're doing with the trainer, is you're not letting it stiffen and round forward. You're trying to keep your body upright, and it's really more for the sake of lumbar 5 that we do that, because the lower back won't make it if your chest is all frozen. Did you feel a lot of what you're feeling in your thoracic cage only after you started stretching, or did you feel a lot of it before you even started stretching? Or the same?
Like pain-wise?
Yeah, just anything, just the front, the back. So a lot of what I'm saying, since you're not a newbie, you've gone through some of these steps. Part of these are transitional pains. They can be.
Right.
Because we are opening up the front. This is going to start hurting because you're starting to lay on a thoracic dental roll, and that's to be expected and hope, it's normal. You're actually part of the treatment. If it was beforehand, it could have, there's other reasons, but it's okay. I'm just, if you don't know.
I think I noticed it's very nuanced, but in your own body you can tell small differences of progress.
Right.
I think the reason I'm here is because it's you come to a certain place where it's kind of like a plateau of how much
improvement you're getting.
Yeah.
Okay. Yeah. We'll check in. Let me see. Across. There we go. Take a deep breath in for me. Head back for me. Let all the air out. There we go. Deep breath in. There we go. Deep breath in. Exhale. Breath in. You'll get it. You did good. Yeah, I know. Take my breath away. Take a deep breath in for me. Exhale. Last side for me. Beautiful. Huh? Deep breath in. Exhale. All right, face up for me. Okay. Right side of your neck is all. This is what I was saying earlier about the injury on the right. I mean, just your head is straight on your torso right here, and everything is pushed out. You feel all this? On the right.
I have more jaw pain on my right. It clicks on this side.
Yeah, you're favoring laying on your left side, person on the left shoulder. Your neck likes to do this.
Okay.
You're saying it doesn't like to tilt to the right. Eventually, it'll cause left arm, left shoulder symptoms because you're going to compress and overstress the left side of your neck, whereas you're avoiding the right side. Long term, we want to try to get your head over to the right. All right. You're going to have more degenerative disc disease on the left. It's not. It's because the tread is wearing out unevenly because of the alignment. There we go. I got you. There we go. There you go. Beautiful.
Nice.
I got you. Chin up. There we go. I think I hit the mic.
Sorry, YouTube.
Sorry, YouTube.
It's funny because when I was thinking about the most concise way to explain what's been going on. I was like, honestly, I'm using some of your language. Yeah, so I was like, I'm literally saying the things that I've learned from your channel back to you. Yeah, and I was like,
it's almost like, you know what you're talking about. Yeah. Who taught you all this?
Exactly.
Wait, stop quoting me.
Yeah.
Yes, very good. Yes, no, you're good. Yeah, it's a tough one. The thoracic cage, a lot of joints in there, a lot of mouths to feed. A lot of whiny little areas that need to be worked on and cleaned, and really don't ever really amount to anything surgically large or major, but can be massively annoying and ruin your day, or and then it ends up just getting stiff, and you forget about it until your sciatic event. That so the healthcare is, let's not allow that area to lock down. Let's keep it flowing, keep everything moving.
It's interesting because the spot that you're hitting right there, if anything touches that, it'll usually start a headache.
Yeah, the injury. Sorry, I know we got to clean this out.
Oh no, I wasn't saying right now. It's fine. That's okay.
One example, I tried the dinner roll pillow.
Yes.
And I ended up giving it back.
Well, we got to
only because it was too much pressure right there, and I was like, I don't think my neck's ready for that.
Right, it's at least a 3-month process to get people's necks prepped.
Yeah.
And if you don't do the soft tissue work, probably even longer than that.
Yeah.
It's.
I realized that.
Yeah, you gotta clean all this and get your neck used to here. Oh, it actually, there, it moved a little bit more there. No, your neck, actually, I can tell you've been stretching. The left feels great. This feels really smooth. Wow, like a butter. It's really just going back to the right side here. It's going to be pretty boring. It's just me. You got to clean up this piece of grit right there. Right there. I'm going to show you, see if we can. Yeah, it's already starting to come out right there. I mean, that was about 5 scrapes. Feel that? That's an injury. It's a tear in the connective tissue in here, and then it healed, tangled. Yeah, you can get, this is not, we would say, completely something that only a chiropractor can do. You can go on eBay or Amazon, get your own,
I was going to say, I've done it a few times on my face, just experimenting, but
yeah, just
not.
Take some oil, and you got to get rid of all this graininess in here.
Okay.
You'll see when you get back to your when you're staying at night, you look in the mirror and go, oh my gosh.
That's all right.
What happened? Both sides have it. Yeah, I'm pretty amazed you don't have any thoracic outlet. They call it, the nerves going down your arm generally would be affected. So you're
it only gets a little bit numb when I am stretching on the dinner roll and I put my arms up.
That's not too
on my left side.
That's not too atypical. Yeah, I'm not concerned about that. I'm talking about just in life. With the discs worn out, they start not preventing the nerve from being hit, and then start getting radiating symptoms down your arms. So from this angle, it's not like it's that much more elevated. The main reason I'm going to work on this is that this is usually a very high, adhesion area, and this area not unlocking or separating from itself prevents you from really getting a good back stretch.
Yeah, the only reason this radiates is like you were saying, the intercostal muscles, all that feels tight.
There's a lot of, this is where cartilage meets bone. There's no spinal cord over here. There's no No nerve impingements over here. It's just a whiny area. A little bit right there, yeah.
Like 1 to 10, how painful?
Oh, it's tolerable.
Okay.
Yeah. Relative to like some other types of pain yeah, it's fine.
Okay.
I mean, it's tender for sure, but
Yeah.
The torso is rotated. Again, it'll level out as we stretch, you know, and then what doesn't level out might need to be there. You know, there's a level, that's what we call structural scoliosis, you know, but you can actually feed a structural scoliosis to be larger than it necessarily needs to be. So we don't, you know, it's how do you know how large it needs to be? And the answer is I don't until you start stretching it, and then you'll sort of arrive at baseline.
Yeah, I mean, it's like T7, T8 area, but right across there is where
I understand.
most of the, I mean, it's totally tolerable.
Yeah, there's just a lot of nerve endings in here, a lot of mouths to feed. You have, you know, ribs and joints between the vertebrae, a lot of, there's like essentially 48 joints in your chest. A lot of mouths to feed. All it takes is 1 or 2 to be upset to ruin your day. You know, I'm dying here. But really, it's only 2 joints that are upset. You know, it's. If I'm going too hard, let me know. I'm gonna keep going deeper and deeper. Okay.
Oh, you're good.
All right. All right. Go right there. Yeah, left's abused. It's the same thing with your right side of your neck, right side of your chest. Everything is locked over here, and then you're just abusing. You mechanically favor the left side, and the left side's going to be where all the wear happens, but it's ultimately due to this side being tighter. Right side of your neck, right side of your chest, and then
I'm right-handed, so
this side gets locked.
yeah.
You lock your chest to move to allow your arm to do specific actions, and so this is. Yeah, right here is all popped up right here. Right there. Kind of more of a crunchiness to it. This is probably the oldest, you know, teenager, you know, dancing or whatever you. And this is where something happened. Feel like it's almost you can feel the rib moving, or just the rubbing over the rib heads. Makes little speed bumps in here. You know, we're always going to heal putting the weight on the less sensitive structures, not putting the weight on the sensitive structures. Yeah, all of this. See, the overwork side doesn't mind being worked more. To me, just kind of get the other side working, and then the abuse that's happening on here will start to calm down, but it doesn't mean we can't go in there and clean it out a little bit. I can't do that anymore without hearing my wife does all the reels and all the Instagramming, and she set it to like Lady Gaga's, so cry tonight.
Because you always hold people's hands.
Don't let go of my hands.
So now you hear that.
That's all I can think of now. When I'm working on people. Been doing this for years now. Stop. It's fun though. Our kids watch the reels. They love them. A little charming wheel.
Yeah.
Gives me. Yeah, found your brought us all this all right here. Oh, this is gonna be cleaned
It's
out.
pretty purple already, wow.
Yeah, right in here. So if you look at the nerve charts, the nerves come out, say if you're in your lower back, they all go down your leg, but in the thoracic cage, they come out and they go directly along the rib. So inflammation right here as the nerves exiting the spinal column causes that radiating symptom. As your care progresses, what will happen very quickly, usually patients that live here in Sarasota, I'm talking like by visit 5 through 7, I can't make a mark on them even if I wanted to.
Oh, wow.
The tissue becomes clean, and then directly at the same time, and I no longer have that. Now, if we don't fix the posture, it's buildup. It'll rebuild back up again really quickly. Right, so it's temporary in and of that it's all due to postural distortion. More and more, I believe, most of the pain is actually in the soft tissue, meaning that it can't be measured on an MRI, let alone X-ray. It's not visible.
Well, yeah, I definitely resonate with that because I came to that conclusion for myself based on eliminating everything else.
Yeah, I call it the immeasurables. There's intangible, aspects of pain that we can't quantify. I think that frustrates the heck out of a lot of doctors.
Yeah.
Right? We want it to be measurable on a blood test, or quantifiable on an MRI, and go, there it is, that's why you're hurting.
Yeah.
Right? But if it can't be measured or imaged, it doesn't exist.
Right.
And that seems to be the prevailing mentality.
I've been learning how to breathe lower
Yeah.
rather than up in my
Your
chest.
abdomen should be going.
Yeah.
Easy test is you just put one hand on your chest, one hand on your abdomen.
Yeah.
As you're watching this and breathe, you should see your belly going in and out. You feel your chest going in and out because you're breathing through the upper part of your chest, not your abdomen. Your diaphragm should cause your belly to go in and out.
Yeah. And there was a whole chunk of my life where I didn't realize that.
Yeah.
And so I think that overworked it too. Or I guess I didn't realize how much of a significant role that ended up playing.
Yeah. Don't pump back on that. All right. Right. I mean, we're doing a significant amount of.
Oh yeah.
This is all.
Yeah.
And that's what everyone's ribs radiating around the front. We got to clean. Like I said, and we're gonna have the thoracic trainer in there, and then eventually even making it taller. Do you do just the thoracic trainer, or do you have blocks underneath it?
I have one,
Kind of
like a 2-inch piece of foam.
underneath it. Okay,
Yeah.
good. Like I said earlier, it's all for the sake of this. If we want to stop beating around the bush and talk about what really matters, it's about not letting this guy go. And all of this is just distraction that causes L5 to, this locks up and gives 10% more burden to this, and this locks up and gives 5%, and then by 30, I had a guy, new patient the other day, 37, and he was, just terrible sciatica. He'd been to the hospital.
Yeah, I noticed, basically my tailbone feels extremely, tender if I, just because it's those muscles overworking.
Well, they're going to lock this joint. So part of why I'm rubbing this area right now is we're trying to keep the SI joint. This joint never has surgery, but the tighter your glute gets, the more inflammation builds up in here. The reason this overstresses is because this is too tight and because the SI joints are too tight. So we're loosening above and below. All right. Exhale for me. Good. Breathe in. Exhale. Exhale. Good. Okay, there we go. I know. That was fun, Ed. Work that a little bit. Deep breath in for me. I got your extra arms. Exhale. Good. Good. Okay. Good. All right. All right. Got it all. Here we go. Last ones. Here we go. A little bit. That's why it's so okay. Nice.
I don't know what your opinion is, but I think I still have muscle imbalance, so it's almost like this. I just feel it pull.
There's definitely more muscle mass on your right quad. Here we go. How long ago was this surgery?
2 years ago. July 2020.
That's a lot of tightness right there. Let me see. I'll compare. Let's see this. Do you see what I'm saying? You feel the difference? How smooth it is over here. I got smooth the whole way. Right there. Hello.
Yeah, my outer quads are always trying to pick up more work than inner.
The tighter this gets, the more the medial meniscus wears, and that's really the patella is not end game. The ACL, the PCL, the medial lateral collateral ligaments aren't. It's all about the meniscus. It always is about that non-sensitive piece of cartilage in there, and the effects of having all these muscles tight or the ligaments injured, introducing a shearing force onto that meniscus. So the looser we keep this area, the more the meniscus can breathe and stay hydrated. Like right there.
Yeah, my knees click and stuff since I was a kid, but I notice when my calves get tight, it's always on the outside, or when my quads get extra tight, it starts clicking more.
Usually don't get much of a mark usually on people's quads, so the fact I'm getting something means that there's more than what we can actually see. Right there. The alignment of your head to shoulders, shoulders to hips affects the knees. So it's more, I was trying to look at the, even though how your foot is, your default is your toes are pointed a little too much here. The default shouldn't be that much plantar flexion. It's either been injury, you've rolled these ankles, or torn these ligaments here. Your foot should be around here. Oh. That's where it should want to be. So the static position is off. And you've stretched this out too much, or rolled these ankles, or ballet. Yeah, that right. So these ligaments here aren't tight enough to hold your foot.
Oh, okay.
There's definitely some crunchies right in here. Mm-hmm. End game, I'm not worried about your ankle. You understand? I'm not worried about the hip socket.
Yeah.
I'm worried about L5 and this meniscus are what are going to define till 90. You understand? That's what's going to be the bottleneck. And so I would encourage you to stretch this quad. There you go, nice. All right. It's okay, there we go. Tilt your head to the right for me a little bit. There we go, yeah, move away. A little bit. A little bit there. I got you. Tilt to the right.
Crunchy.
Yeah.
Have you ever had that?
Okay. Only seen it on video.
Go ahead, tilt left. There we go, yeah. Grip on there. Go ahead and tilt to your left. There we go. Ooh. I'm going to come over here. Think a little bit. Is that about where you've been using it?
Well, that was a big question for you too, because I was almost like holding it here and then a little bit further down, and I was like, I don't know the best spot.
You're going to do the whole thing. The main thing is that you're making your contact and getting a downward tissue pull. So after you've made your contact, I want you to try to push with your feet. Good. Get the idea? Mm-hmm. And you want that little bit of maybe half-inch sliding upwards. Okay. You want the vertebrae to fold on each other. Okay. You don't want to get in between and then create an upward pressure, meaning that you're spacing the vertebrae out. You want to fold them. How many times have you done the thoracic trainer, and how long have you done them each time, and how many times have you done it?
It was about a month and a half.
Okay.
And each time, I mean, probably 7 minutes is my average.
Okay. Did they say 20 minutes, or did they say 7 minutes was okay? What was the training you were given?
Not a whole lot of training.
Okay.
Watching your videos.
You're the best around. Okay. All right. So 20 minutes is where the magic happens.
Yeah.
You have to. That doesn't mean 7 minutes is bad. Not.
Yeah.
That's a good way to get to 20, but 7 minutes is not end game. You won't see permanent change if you're stopping at 10 minutes or you're stopping at 15 minutes. You've got to get to 20 minutes. Now, what I would do is, if it's too difficult, you reduce the depth. Does that make sense? So you put a book or block behind your head. Maybe you start 10 minutes with a book behind your head, and then you end on the high note. So you end without any support behind your back.
Mm-hmm. Okay.
But you want to be at 20 minutes, and then as that gets easier and easier, especially after 20 sessions at 20 minutes. So if you did 2 a day, it'd be 10 days. 20 times 20 minutes.
Okay.
That's when you should see a marked difference. It's more important that you get time than it is about depth, especially the first dozen times you do it.
Okay.
If it's too difficult, you end up just taking the thrown across the room. No! We gotta get used to brushing. You gotta work on that right side. So I would, no person on the left shoulder. I feel like no phone in the left ear. Don't do any, everything. I want you focusing on trying to, all that shoulder height misalignment we saw earlier is like I said, a result of the head tilt. We've got to get your head over to the right.
This is helpful because I think I had it tucked too far under my shoulders.
Too low. Okay.
Yeah.
Like I said, you have that right neck injury. It's really, getting that head over to the right, and then that'll get better. All right, very good. Thanks so much.
Thank you.
All right, thank you.